From CPRE and the CPRE Knowledge Hub, this is Research Minutes, a weekly look at new and important research in education. Today, we look at parents and how their newfound role as proxy educators may be having an impact on their mental health.
And we had different questions about self-reported anxiety and depression and trouble sleeping. And we kind of see this consistent effect that if you have a child that's struggling with this distance learning format, then the parent's going to have this elevated level of mental health stress across these dimensions.
We welcome UNC Chapel Hill's Cassandra Davis and Indiana University Bloomington's Alberto Ortega, co-authors of a new research brief examining parental mental health in the wake of the COVID-19 pandemic. They share what they learned from their analysis.
So we saw that from individuals who said that they were living from kind of paycheck to paycheck, as well as in parents who were doing financially well within their household, that everybody who had a child who was struggling was also struggling themselves.
And some important takeaways for parents, educators, school leaders, and other stakeholders working to support students and each other in the months ahead.
We're suggesting that schools, educators, and parents can use this time to either create or build upon or even maintain a relationship with each other.
That's right now on Research Minutes. Hello and welcome to Research Minutes. I'm Keith Heumiller, Managing Editor of the CPRE Knowledge Hub. Today, we're happy to be speaking with Cassandra Davis, Research Assistant Professor of Public Policy with the University of North Carolina at Chapel Hill. Welcome, Cassandra.
Hello, thank you for having me.
And also with Alberto Ortega, Assistant Professor with the Paul H. O'Neill School of Public and Environmental Affairs at Indiana University Bloomington. Thanks so much for joining us, Alberto.
Hi, Keith. Thanks.
So today we're discussing your new research brief, which was co-authored by Jave Grooms, Edward Vargas, and Joaquin Alfredo Angel Rubalcaba, titled Distance Learning and Parental Mental Health During COVID-19. It was just published in Educational Researcher, and it takes a unique look at the new roles that parents have taken on in the wake of the COVID-19 pandemic, and how serving as what you call proxy educators may be contributing to elevated mental distress. To start, I'm curious what led you to this line of inquiry. Were there specific questions you had or indicators you saw that led you to investigate parental mental health?
We rely on the National Panel Study of COVID-19, which is a multi-wave survey that was intended to track the impact of the coronavirus pandemic. And we had the opportunity to collaborate with researchers that were going to send out the second wave of the survey at kind of the beginning of the initial wave of the pandemic. And we noticed that they were covering many topics like mental health, but there were no questions about schooling. And when schools and colleges started to transition to remote learning, we suspected that this could have detrimental effect on students' academic progress and how households were coping with this new format of instruction and schooling. So we decided to include questions about experiences with school. And in combing through and cleaning the data, we saw that about roughly half of the survey respondents indicated that at least one of their children was struggling with distance learning. So we said, okay, so it's not everyone who's struggling with distance learning. We wondered how this could affect the well-being of parents, because there were already some questions in there about mental health. So that's when we decided to examine this relationship between children struggling with remote learning and parental mental health.
To also add to that, we all had a very real and kind of, to some extent, a personal connection with this. We could all relate to this idea of being a professional who is also working at home and who's also parenting. So we were really interested to see what the data said about mental distress for parents while their children are at home during this virtual schooling event.
And could you give us an overview of your approach to this analysis?
So we compared survey respondents that indicated that they had at least one child that struggled with distance learning to those that reported having no children struggling. We then examined whether this relationship existed with self-reported measures of mental distress. So we looked at measures of anxiety, depression, trouble sleeping, and a couple others. And we controlled for demographics, including age, race, worker status, whether the respondent was living paycheck to paycheck, And just kind of did a simple analysis, controlling for things, not controlling for things, just seeing what happened. And we saw that the relationship that we found was pretty robust.
And also with that, we are aware that there are several studies that talk about the implications around educators' efficacy as well as their effectiveness. And we know that a lot of studies that talk about teacher burnout. So we were very aware that some of the reasons why educators talked about leaving the classroom was just being exhausted or just kind of mentally distressed or just kind of struggling with different things within their classroom. So we were really interested in the extent that also occurred within parents who are assuming this new role as an educator at home.
So let's jump right into your findings then. What did you learn about parental mental health in the wake of the pandemic?
So our key findings, we found that parents with children who struggled with distant learning experienced elevated levels of mental distress. So the disparity in mental health distress resulting from difficulties with distant learning is independent of income, the number of children within the household, as well as days since school closure. We also, I think some of the things that really surprised us was that all parents struggled with mental health across socioeconomic classes. So we saw that from individuals who said that they were living from kind of paycheck to paycheck, as well as in parents who were doing financially well within their household, that everybody who had a child who was struggling was also struggling themselves.
And to add to that, this finding was true across essentially all of our measures of mental health distress. Again, we had different questions about self-reported anxiety and depression and trouble sleeping. And we kind of see this consistent effect that if you have a child that's struggling with this distance learning format, then the parent's going to have this elevated level of mental health distress across these dimensions.
So probably not surprising findings for many of the parents slash proxy educators out there, but it's still a stark reminder of what parents must be going through, even as we speak, which we are speaking right now at the end of January, and we still don't have any clear indication of when and how schools across the country will be resuming in-person instruction, with some form of remote instruction likely to carry on for many families throughout this spring. I'm curious, what should parents or even instructors or school leaders take away from your work here? Are there steps or strategies that stakeholders can adopt to help mitigate this mental stress going forward?
Absolutely. So for our study, we're not suggesting that schools should be reopened to salvage parents' mental health. Instead, we're suggesting that schools, educators, and parents can use this time to either create or build upon or even maintain a relationship with each other. So some of our suggestions are that they can meet virtually, creating a space where they can talk about, what are some needs that should be met or can be met. So for the parents, for the educators, it's a difficult time for all of us. And so what a unique time where all of the groups, the educators, the principals, the teachers, the proxy educators, the guardians, the grandmothers at home can really come together and can talk about meeting the needs of children, meeting their academic needs and meeting their social and emotional needs. We're also suggesting that in both groups, that proxy educators as well as the academics should be open about their needs and really communicate those needs to the schools.
So are there opportunities here for future research, either for your team or others who might be working in this area?
Yeah, we are working on a related line of research that looks at school-initiated communication or provision of resources during the pandemic and how these resources or communication, how has that affected parents' well-being? Has that affected how much they trust or their perceptions of the child's schooling? So, how schools communicate and provide resources to children and their families is particularly important given that there's new research that shows that in areas of the country with higher income, those individuals in those areas are more likely and more readily able to find support outside of what's provided by the school.
Right. And along those lines, especially when we're talking about trust during COVID-19 has been an interesting topic to say the least. And so by conducting this analysis, our hope is that the findings will reveal some bit of direction on where we may see that a type of provision or a type of resource can lead to or can facilitate greater trust among certain parents. What a great resource to use in this time of trying to build and maintain relationships with parents. So we're really excited about this project, and we hope to get it out and especially make sure that it reaches the communities and the schooling communities that are in need.
And even beyond our work on trust and how parents perceive schools and how they're doing during the pandemic, just generally examining how the parental stress or a parent's mental health affects the child's academic outcomes just generally is going to be of interest. We know that students are definitely going to be set back by going to the online format, but we should look into how parents' stress and their mental health, how that might affect their child's academic outcomes as well.
Certainly. And the work that you've done here is just really incredible, and it could not be more timely. And we want to encourage our listeners to go and read the full brief. Again, it's titled Distance Learning and Parental Mental Health During COVID-19, and it was just published in the journal Educational Researcher. Cassandra Davis and Alberto Ortega, thanks so much for joining us today.
Thank you.
Thank you. Thank you for having us.
Thanks for listening to this week's Research Minutes, presented by the CPRE Knowledge Hub. For more episodes or to subscribe to the series, you can find us at researchminutes.org. To share thoughts on today's episode or to suggest a future topic, you can follow us on Twitter at CPRE Hub. That's CPRE Hub.